What is VO2 max? How do we measure it? And how do we actually improve upon our VO2 max? More and more evidence that I'm reading in the literature is that VO2 max seems to be a very good and reliable indicator of all causes of mortality and potentially longevity for life. There are just so many benefits to improving your VO2 max, or essentially bringing your oxygen to your brain and your muscles, and that they might even consider making this a clinical vital sign in internal medicine, meaning that everyone should get a VO2 max done because of how important the findings are. Meaning, when I say higher VO2 max, it's a less risk of cause of cancers, heart attacks, and so forth. So when we say VO2 max, what does that mean? VO2 is a volume or the amount of oxygen that your body can consume during maximal exercise. Oxygen is important, as I'll discuss shortly, of energizing our body and converting that to the muscles. So the physiology behind that is that oxygen helps convert sugar into energy for your muscles to perform work. If you run into an oxygen deficit, then your body starts to use other ways to convert into energy. And that's called the anaerobic process, or without oxygen. And it's called glycolysis. And the byproduct of that is lactic acid. So when you feel your muscles get to burn, that's the byproduct of an anaerobic situation. So ideally, you can use oxygen more readily if you improve your VO2 max, so you don't have to fall into the anaerobic pathway to consume energy. So how do we measure? There are several different ways to measure. The easiest ones, I guess, are the fitness test. Some ones that I picked are the Cooper test. You just get a timer and go as far as you can in 12 minutes, and you measure that distance. The formula below is 35.97 times the amount of miles minus 11.29. Don't tell me how they got those numbers, but essentially that gives some indicator of your VO2 max doing the fitness test. They also do the 1 mile walk test, and after 1 mile, you test your heart rate and time to complete that, and that should give you some understanding of what your VO2 max is. I want to talk quickly about the smartwatches, as technology is improving and everyone has seemingly an Apple Watch or some kind of device. Smartwatches use heart rate, pace, and other data like GPS to determine your VO2 max. I was a little bit skeptical at first about the watches and how accurate they were, given that they don't actually have a measurement of exchange of what you're breathing in and breathing out. But Apple did a study of their own watches, so it's an Apple study, but they recruited about 780 people to test the VO2 max. And it was pretty dang reliable of like consistency with the same person doing it twice to get similar results. And it's within about 4% of true value. So it's a pretty good estimate of a VO2 max. But the gold standard is gas exchange. Essentially, you have a mask on you. You're on some kind of treadmill or bike, and you go until you're exhausted. Every couple minutes, you just increase the incline or the speed, and you keep going until you just can't go any further. The Bruce protocol, I'll put that in parentheses there, because people that maybe can't run as much, like the elderly population, it's more of an incline base. So you're walking and you're just increasing the incline, and again, until you can't go any further. Now, what's important about this is the mask has to be sealed. At the clinic that I work at, we use a portable mask where it's not tied to any tube. So that's a little bit better, so you don't feel too tied down to the medical unit. It's measured in milliliters of oxygen per kilogram per minute. So there are standards. I won't read them all. You can see on the screen. So where am I? I'm 41, male. So down here. So good would be between 39 and 43, excellent 43 to 48, and superior above 48. So as you get older, VO2 max standards go a little bit lower for a variety of reasons. Not only things don't function as well, the heart is not as strong. Females, of course, have a little bit lower VO2 maxes relative to males, but I've seen some very impressive female stats come through. So the reason why females tend to have lower values than males, to my understanding, really it just is the physiology of the makeup of the muscle. For lung capacity, for bigger lungs, because men tend to be bigger, that could be a factor. But I think it has to do with the amount of muscle on the body translating to that result. So after I test people, and the test usually takes, if I'm doing the standard treadmill with the mask on, usually about 10 to 15 minutes, depending on the person. The next question they ask is, how do I improve upon that? Running in general will improve it. Now, if you really want to push it, the ideal world is intervals or intense bouts of exercise for a short period of time. The heart is a muscle, and that pushes the heart to work harder and get stronger and push out more blood into the body. So one common protocol is a 4x4, where you go as hard as you can for 4 minutes and then chill out for about 4 minutes and do that 5 to 6 rounds. So you can get pretty pooped after that. Others I heard was about 30 to 90 seconds. Say on a track, go as hard as you can for about 90 seconds, and then you can rest, do that 5 or 6 times. The cool thing about this is you don't need to do this for like an hour or two. Sprinting intervals for like 20 minutes will push that VO2 max up. The bottom line is you just have to intensely push your heart for a short period of time. If you run for long periods of time too, that's great. That will also help improve it, but this seems to really push it up a notch for you. And so with the VO2 max, it's great to know that number, but especially if you're a newer runner, I wouldn't go out and test it right away. If you go sprinting too hard, too fast, you might be prone to an injury and overuse. So I would still train accordingly, start with a walk-run program and build up your foundation. And then when you get to a place where your muscles are strong and you feel pretty good running, then you can start stressing the system a little bit more with those VO2 max tests. But I wouldn't recommend doing it right off the bat, just because you could strain your tissues and get some injuries.